Welcome to another video on 13 uncommon signs of high blood sugar. Type 2 diabetes or diabetes mellitus is often called a silent killer because its early warning signs can be very subtle and easy to miss. The symptoms it causes can be so unexpected that you wouldn't think they're related to high blood sugar levels. Diabetes is a condition in which the body either cannot make enough insulin, type 1, or cannot use it well, type 2. Both types lead to too much sugar, glucose, in the blood. Today's video will discuss 4 common signs of high blood sugar and 13 uncommon or unusual symptoms. Let's dive right in. Diabetes and high blood sugar exist on a range, without a clear threshold where problems suddenly appear. The optimal daily blood sugar range is 70 to 80 milligrams per deciliter, with an HbA1c below 5.5%. Once your blood sugar levels start to increase beyond this healthy range, you enter the diabetes risk zone, inviting potential long-term damage associated with elevated blood sugar. Preliminary stage high blood sugar and prediabetes. Fasting glucose levels between 100 to 125 milligrams per deciliter and HbA1c levels between 5.7 to 6.4% should not be underestimated, as they already pose risks to your heart, blood vessels, and other organs, even without a complete diabetes diagnosis. Each year, roughly 1.5 million Americans are diagnosed with diabetes, but many cases might go unnoticed. Therefore, if you've been diagnosed with prediabetes or metabolic syndrome, it's crucial not to dismiss the risks until your blood sugar reaches diabetic levels. First, let's explore 4 common symptoms of type 2 diabetes. 1. You experience increased thirst and more frequent urination than usual. One common yet often overlooked sign of high blood sugar is increased thirst and urination. When glucose levels rise too high, your kidneys work overtime to remove the excess sugar, causing excessive urination, polyuria. This leads to greater thirst and can leave you feeling dizzy or lightheaded. Avoiding sugary drinks or fruit juices is essential, as they can further increase blood sugar levels. While thirst and urination can be influenced by factors like environment, exercise, dehydration, diet, or medication, frequent symptoms may indicate diabetes. 2. You feel intense hunger. Uncontrolled high blood sugar, known as polyphagia, can make you feel starving. When your body can't manage blood sugar well, levels go up and down, making you feel shaky, hungry, and irritable. This often leads to cravings for sugary or carb-heavy foods, but eating these only worsens things. To keep blood sugar stable, focus on healthy fats and protein, and eat low-carb foods. This helps stop the hangries and prevents blood sugar spikes and crashes. 3. Have a slow healing wounds. High blood glucose levels can slow wound healing by preventing nutrients and oxygen from reaching cells, hindering the immune system and increasing inflammation. 4. You constantly feel tired and exhausted. Fluctuating blood sugar levels can disrupt your energy, leaving you tired. When insulin is insufficient or not appropriately processed, sugar stays in your blood instead of fueling your cells. This lack of glucose causes tiredness, and frequent urination from high blood sugar can lead to dehydration, further contributing to fatigue. Now, let's explore 13 less obvious or more unusual symptoms of diabetes. 13. Darkening skin patches. Darkening skin patches, known as acanthosis nigricans, these velvety, dark patches often appear in the folds of the neck, armpits, or groin. This condition is related to high blood sugar because it typically signifies insulin resistance. When your body becomes resistant to insulin, it requires higher insulin levels to manage blood sugar. Elevated insulin levels can trigger abnormal growth of skin cells, leading to the thickened, dark patches characteristic of acanthosis nigricans. This skin condition can serve as a visible warning sign of underlying issues with blood sugar regulation and potential diabetes. 12. You experience intimacy issues. High blood sugar can worsen both nerves and blood vessels, leading to intimacy issues in both men and women. In men, this can appear as erectile dysfunction, where achieving or maintaining a firm response becomes challenging. High blood sugar can lead to reduced lubrication for women, physical intimacy is uncomfortable or painful, and can also decrease intimate interest and excitement. The damage caused by high blood sugar affects blood flow and nerve signaling, both of which are critical for normal intimate function. 11. You feel lightheadedness. High blood sugar can cause dizziness for several reasons. When glucose levels are elevated, your body attempts to remove the excess sugar through frequent urination, leading to dehydration. Dehydration decreases the volume of blood circulating in your body, which can reduce blood flow to the brain and lower blood pressure, resulting in dizziness and lightheadedness. 10. You feel itchy. High blood sugar can damage nerve fibers, especially in the hands and feet, causing itching. It also damages blood vessels, reducing circulation, which leads to itching and peeling by drying out the skin. Proper blood sugar management is essential to prevent these issues. 9. You experience pain in your limbs. When high sugar levels cause nerve damage, known as diabetic neuropathy, you may develop complications such as pain, cramps, This pain can happen in the legs, hands, and feet, or you may experience tingling, burning sensations, or numbness in your limbs. Number 8. You have recurrent infections. Higher than usual sugar levels can feed yeast infections like Candida and certain pathogenic bacteria. Candida thrives on glucose, so your diet may unintentionally encourage its overgrowth. Typically found in the digestive tract and genital tract, Candida is usually kept in balance, but an out-of-control infection suggests an imbalance in your immune system or blood sugar levels. Excess glucose in urine also creates an ideal environment for bacteria and yeast. Recurrent urinary tract infections and frequent yeast infections are strong indicators of seeking medical advice. Number 7. Unexplained weight loss can indicate high blood sugar despite everyday eating habits. When the body can't effectively use glucose for energy due to insulin resistance or lack of insulin, it starts breaking down muscle and fat. This process, known as catabolism, occurs because the cells are starved for energy, and the body seeks alternative sources. Consequently, significant weight loss can happen rapidly, even if calorie intake remains unchanged. This symptom is often one of the early indicators of diabetes and highlights the body's struggle to manage and utilize blood sugar properly. On to our number 6. You have a dry mouth. While thirst is a common symptom, a parched mouth can be an unusual sign indicating your body is trying to counteract dehydration caused by high blood sugar. In response, the salivary glands may produce less saliva, leading to a persistently dry mouth known as xerostomia. This dryness can affect oral health, increasing the risk of tooth decay and gum disease. Number 5. Your vision is getting blurred. Blurred or hazy vision can be an early sign of high blood sugar levels. When blood sugar rises, it causes the eye's lens to swell by pulling in more fluid. This swelling changes the shape of the lens, affecting its ability to properly focus light onto the retina, leading to blurred vision. Additionally, high blood sugar can damage the retina's blood vessels over time, compromising vision. This condition, known as diabetic retinopathy, can cause more severe vision problems if not managed. Therefore, persistent blurry vision should prompt a check of blood sugar levels and a consultation with a healthcare provider. Number 4. You begin to experience hearing loss. Fluctuating blood sugar levels can significantly increase the risk of hearing loss, as this condition impacts the inner ear in multiple ways. Long-term high blood sugar can damage the small blood vessels and nerves, impairing the inner ear's ability to properly transmit sound signals to the brain. Conversely, prolonged low blood sugar can also disrupt how the inner ear sends nerve signals. This explains why individuals with diabetes are nearly twice as likely to encounter hearing loss compared to those without the condition. Number 3. You feel depressed or irritable. Sudden changes in blood sugar levels, common in diabetes, may contribute to mood changes. Excess sugar and starch can disrupt the gut microbiome, which produces much of the serotonin that regulates mood. A 2017 review found that post-meal blood sugar fluctuations caused anxiety and depression in people with type 2 diabetes. These fluctuations can also negatively impact cognition, affecting attention and focus. Number 2. Your breath starts to smell fruity. Fruity smelling breath can signal that your body is decomposing fats for energy instead of glucose, producing a byproduct called ketones. This typically occurs when insulin levels are too low for the body to use glucose efficiently, a condition often seen in uncontrolled diabetes. As ketones accumulate in the blood, they can be exhaled through the lungs, causing a distinctive fruity odor. This symptom is particularly worrisome as it may indicate diabetic ketoacidosis, DKA, a severe and potentially life-threatening condition requiring immediate medical attention. Monitoring and managing blood sugar levels can help prevent the development of ketones and associated symptoms. Number 1. You have bleeding or swollen gums. Red, swollen, and tender gums can be a sign of periodontal disease, which is more common in individuals with high blood sugar. Elevated glucose levels can weaken the immune system, making it hard for the body to fight infections, including those in the gums. High blood sugar can also lead to poor circulation, lowering the supply of oxygen and nutrients to gum tissues and impairing their ability to heal. This creates a condition where bacteria can thrive, leading to inflammation, tenderness, and swelling in the gums. Maintaining blood sugar levels is essential for managing oral health and preventing periodontal disease. The symptoms we've discussed, such as fatigue, irritability, or increased thirst, can also be due to other health issues. Stay calm if you experience them briefly. However, if these symptoms persist and are accompanied by other diabetes warning signs, see your doctor. They will do blood tests to check your A1C levels, providing an overview of your blood sugar stability over the past 3 months. They may also perform a fasting glucose test. It's important to request an insulin level test as well, since insulin levels can rise before blood sugar does. To reverse type 2 diabetes and prediabetes, make critical dietary and lifestyle changes. A diet rich in antioxidants, organic vegetables, fruits, along with targeted natural supplements can help stop diabetes progression and reduce bodily damage. If you enjoyed this video, please subscribe, like, and share. Remember to click on notifications so you get all the videos.